Welcome to 10 Time Management Tips for Nurses. My first tip is to learn to prioritize. Even though 12 hours makes for a long shift, we all know they can go by quickly. Make sure you're focusing on the most important tasks first. When you're faced with choosing between two options, think to yourself, what's the consequence if I don't do this task right now? Will this decision result in a patient safety issue? If so, it probably should be done first. We know there are a ton of tasks to complete throughout your day, but remember that patient safety and your safety come first. Let's say you have a jar that you need to fill with rocks and sand. If you put the sand in first, you won't have room for the larger rocks. However, if you put the rocks in first, you can pour the sand in and it will fill the space around the rocks. What's the point? Make sure you make time for important things first, like patient safety, assessments, medications. The little things will fit in the spaces in between. Prioritizing patient care can be one of the more difficult aspects of being a new nurse. Asking yourself, which patient should I see and assess first, early in your shift can help you prioritize your morning. Always remember your ABCs, so if you have a patient with compromised airway, breathing, or circulation, always see them first. Also ask yourself who's your sickest or highest risk patient. This can be hard. I know we get questions like this in nursing school all the time, but luckily we're in the real world now and no one's grading us. So just use your best judgment and try to see all of your patients early in your shift so you can get a good baseline for everyone. For example, if you have a patient on a vent and one with a wound vac, see the vented patient first. If you have a patient who's recovering from lung surgery and another recovering from a knee replacement, it's probably a good idea to see the lung surgery patient first. Unless your lung surgery patient's vitals are great and your knee replacement patient has a fever and their blood pressure's dropping. Just think it through, use your judgment, and trust your gut instincts. There isn't always a right or wrong answer, so just do your best and always get a second pair of eyes if you feel like you need help. My second tip is to make lists. It's important to know yourself on this one. How long can you remember something without writing it down? How many tasks can you keep track of at once? Personally, I forget just about everything if I don't write it down, so before each shift, I make myself a checklist for each patient with every hour listed on the sheet. Then throughout the shift, I can write to-dos based on what time they need to be completed and cross them off once they're done. On the other hand, I have a friend that I used to work with that remembers just about everything and hardly ever needs to write anything down. Like any of these tips that I'm going to give you, just find what works for you. Try different formats. Are you a post-it person? Is there a certain way you like to keep track of your to-dos? Whatever you do, just make sure you find an effective way to keep track of your important tasks. And from personal experience, writing things on your arm is not the best way to stay organized. My third tip is to cluster care. Have you ever found yourself going into a room and passing a medication, only to leave the room and realize you forgot another medication or to do your assessment? This happens to all of us, but clustering care can help avoid the frustration of going in and out of your patient room more than necessary. Before you go into a room, especially PPE rooms, make sure you think through what this patient needs. Do they have medications that need to be passed? Do they have a dressing change that can be done during their bed bath? Do you know that this patient will probably ask you for ice chips? Take the time to plan it out so you can grab everything you need to go before you go in. Also, try to group tasks whenever you can. For instance, if you have medications due at 7:30 and 8, check to see if they can all be given at once. Tip number 4, get to know your patients. We've all had that needy patient that calls constantly throughout the shift, which can eat up precious time to complete important tasks. The best way to deal with this situation is to try to get ahead of it by getting to know your patient. Are they calling about going to the bathroom a lot? Try frequent rounding to get them up to the bathroom when you have time to prevent them from calling when you don't. Are they constantly calling about pain meds? Write the times the meds are available on the whiteboard and try to round on them a little before the available times to assess their pain. Are they asking for a lot of water? Try to fill up their mug on your rounds. Basically, try to anticipate the needs the best you can and utilize purposeful rounding to meet those needs. Tip number 5 is to utilize your resources. Remember that you are not alone. All of us have bad days and all of us get overwhelmed. It's vital in situations like this to know who your resources are. Your peers can help you, so assess the people around you. Is someone else caught up that might be able to help you? Is there someone, maybe a preceptor that's more experienced than you that might have some good tips? Your charge nurses are here to help you. Yes, they get busy, but they want to know what's going on. Make sure you communicate with them. They usually don't know if you're drowning unless you say something. HCAs are there to help. Are there some things you can delegate? As the world's worst delegator, I know this one can be hard, but remember we are a team. Make sure you're working as a team and sharing the load when you can. Remember to also put yourself on the other side of the equation. If you are caught up and see a nurse or HCA struggling, offer to lend a hand. For those of you in resource, my extra tip is to find a buddy early in your shift. Working resource can be hard because you don't have a home unit where you get to know your team really well, so make sure when you are on a unit, especially one that you haven't been to very often, find a buddy quick. Whether it's a charge nurse, an experienced nurse, or even just the first person who smiles at you, having someone who will have your back can be a huge lifesaver when your day gets crazy. My 6th tip is to take a lunch. I know this seems counterintuitive if you're super busy, but taking a break is important. You will be much safer providing care to your patients if you take a few minutes to eat and relax. A lot of things can wait, and I know some things can't, but if you're deciding whether to take a lunch, ask yourself, is there anything on my to-do list that absolutely can't wait for 20 or 30 minutes? If it can't wait, can I do it now and then go to lunch right after? Or if I can't go after, is this something someone else could do for me while I take my break? We've all had shifts where the answer to all of the above is no, but those days should be the exception, not the rule. Tip number 7 was something that helped me a lot as a new grad, and that is charting early. I know charting doesn't always feel like the most important thing, but it's something we have to do. Making a record of our care helps bridge the communication gap with other disciplines and future shifts, ensures continuity of care for our patients, and can protect us from future legal issues. It's a big deal. It takes time to become familiar with charting systems, but keep working on it, and you'll get faster and faster as you become more experienced. Charting in real time can be annoying when you have so much to do, but I promise you, you will feel a zillion times more in control if your morning charting is out of the way early in your day. Number 8 is one of the first things I learned as a new ICU nurse, and that is don't panic. Panicking in any aspect of nursing is never helpful. It ruins your ability to focus and react to critical situations. If you're faced with what seems like a panic-worthy situation, if it's urgent, act quickly. Take care of the situation. If it's not urgent, take a breath, prioritize, and figure out how to deal with it. And importantly, don't let someone else's panic make you panic. Make sure you know when to ask for help and get assistance with critical situations. Another helpful thing is to think through potential critical situations before they even happen. This might be a negative way to think, but I found as a new nurse when I walked into a room, if I thought, okay, what if this patient coded right now? What would I do? It would remind me to do a safety sweep to make sure I had the right equipment. Also, having thought it through fairly frequently helped me know exactly what to do when my patients actually coded. I didn't have to freeze or panic because I had already decided how I was going to react. My 9th tip is to remember that you are human. Be patient with yourself. You can only do one thing at a time, and that's okay. If you need to do 2, 3, or 7 things at once, consider getting another set of hands to help you out. When I'm overwhelmed and feel like I'm drowning in my to-do list, I take a second to breathe, then I look at my list, pick the most important things, and go for it. Yes, sometimes that means my bath was a little later than I meant it to be, or that I charted on my care plan later than I should have. But some days, that's the best I can do. Just take it one step at a time and work your way through it and try again tomorrow. Also, we're not robots, so not everything works the same for everybody. Find a workflow that works best for you. Pay attention to how the people around you are working through their day and pick what you like. It can also be helpful to ask for feedback from preceptors and experienced nurses. Ask them how they manage their time. Do they have any tips for how you could be more efficient? Most nurses are ready and willing to share their experience with you. My 10th and possibly most important tip is to take care of yourself. Nursing is really hard, and we spend so much time taking care of others that we often forget to take care of ourselves. But if we don't take the time to rest and recuperate from our shifts, we can't be our best selves when we're working. My advice is to be present wherever you are. When you're at work, work hard and focus on your patients, while also making sure you hydrate, eat, and pee. When you're home, be at home. We do all need someone to talk to, be it a friend, a coworker, family member, or even our awesome staff at the Resiliency Center, for which I've included the link below. So vent when you need to, debrief at the end of the day, but then let it go. Live your life, play the guitar, be with your family, walk your dog, watch Netflix. Do whatever it is that you need to do to get your mind away from this place. When I first started as a nurse, I was constantly thinking about work. I was worried about what I didn't do right, worried about my patients and how they were doing, worried about how my next shift was going to be. I was dreaming about the hospital constantly, and I started to dread going to work. This is pretty normal for a new grad, but it'll also drive you crazy pretty quick. Again, remember, no one's perfect. It's okay that your wound dressing didn't look as pretty as Jenny's did the shift before. It's okay you were late with your meds today. And no matter how hard you think about them, worrying won't make your patients any better. I know that sounds harsh, but it is so important to learn to let go. You need to go home, do what you love, and be both mentally and physically away from the hospital when you're home, so that when it's time to come back, you're refreshed and ready to tackle your day. Thanks for listening to my 10 time management tips for nurses. I just want to remind you that nursing is really difficult, but it's also incredibly rewarding. So make sure you take care of yourself out there, get help when you need it, and do your best to manage your time correctly so you can take efficient care of your patients, and it will help you have a much better experience in the nursing field. Good luck out there.